Well, hey everybody. This is episode 2 of my tinnitus talk for my YouTube channel called My Journey to Habituation. My name is Tamara. I am so excited, so happy to have Dr. Michael Golenhofen with us, all the way from Germany. Thank you so much for taking your time to be here with me today and to talk about tinnitus and your experience with it and with treating it. And I'm really hoping that some of the stuff that we talk about today is going to be helpful to a lot of the people that are out there listening. So thank you so much.
You're most welcome. I'm very glad to be here. Thank you for having me, and I hope we can bring forward everything that has to do with tinnitus, and that's the reason why I really like to be here.
Thank you. A lot of us in the tinnitus community know you that you're an ENT specialist, but a lot of people don't know that you also studied naturopathy, homeopathy, osteopathy, a lot of traditional Chinese medicine, shamanism, a whole bunch of stuff. How do you feel like marrying those two worlds together, the medical and the ancient? How do you feel like that is helpful in your treatment of tinnitus with your patients?
Yeah, that's a very interesting question. I think, first of all, it is very useful and also necessary the moment you want to treat somebody experiencing tinnitus to broaden your spectrum of scope. Because one of the major difficulties for tinnitus sufferers nowadays is the fact that they do not feel heard in their complaints. They simply rarely find somebody to talk to and feel heard and understood. And for that, which we'll touch later on, for us as physicians or therapists in general, it is important to understand what is happening on the other side in this human being.
Yeah.
And for that, it is so important and helpful to have a wide spectrum the moment you encounter somebody and you want to understand what is happening. And in the beginning, it was very important for me to just learn more than the medicine that I learned in medical school. Over the years, when I accomplished things in naturopathic medicine and all these disciplines, and combined that with modern ENT physician kind of work, it became not so extremely important anymore. Today, I'm not talking of naturopathic things or conventional things anymore. It's just one big area that helps me to understand the person that is sitting in front of me. And that is extremely important and helpful to my patients, I hope.
And I think it's helpful for us as the patient. We've all had that experience where we walk into a doctor, whether it's at the hospital or an ENT, and we tell them what we're experiencing. And we've all heard that, sorry, can't help you. Sorry, there's nothing you can do. Sorry, you're just going to have to get used to it. So as a patient, as somebody who suffers with tinnitus, that's really special, I think, to be able to talk to a doctor that understands more than just what it says in a medical book, to understand that tinnitus is just not this thing that we don't understand how to treat, but if you just dug a little deeper, that you could really help your patients a little bit more. So I think that's awesome. That's really great.
As a matter of fact, if I may jump in here, as a matter of fact, the way we describe tinnitus in the international guidelines, no matter where you go, US, America, Canada, European countries, all over the world, tinnitus is on one side described in some ways, on the other side, it is understood as something that is not understood.
Mm.
So there is no idea in us as physicians to kind of help us to understand the patient in front of us. We very quickly jump to conclusions like giving a symptomatic treatment right away.
Mm.
Stop thinking, apply symptomatic treatment right away. And this is difficult for us, but primarily it is difficult, if not detrimental, to the person who sits there and comes and asks, what's happening with me? And not to receive an answer to this question is a huge problem. For many tinnitus people, problems really start that moment.
Yeah.
They come along quite okay, but when they start to meet physicians and they're confronted with the attitude of, I'm not telling you anything of what you actually have. What I tell you is you need to come along with it. I cannot help you really. We just give you a symptomatic treatment of behavioral therapies, and that's it. And then the problems usually start because as human beings, we want to understand what's happening and we want to know what we can do.
Yeah.
We want even to know what's the meaning behind all that. What can I learn from that? Can I become wiser? Can I become healthy again? This is the question. These are the questions that really are interesting for us.
Yeah.
And these questions are not answered. And that's why tinnitus sufferers feel so misunderstood, not heard, and so desperate after visiting ENT physicians worldwide. It's
Yeah.
everywhere the same thing.
Yeah. When we met, I learned a lot of things about tinnitus that I didn't know myself, and I feel like at that point, I felt like I knew so much, but when you started talking, I just realized I knew nothing. I only knew the information that was kind of floating out there, but I didn't really understand that there could be so many different underlying issues that could cause tinnitus, that it's different in everybody. Um, you talked about subtypes. Could you please explain how many different subtypes there are and what exactly they are?
As a matter of fact, on one side, why this thinking is the solution for tinnitus sufferers is because to have somebody telling me a symptom, no matter if it's tinnitus, if it's headache, if it's stomach ache, or whatever it is in medicine, the primary obligation of a physician or any kind of therapist is to make up a diagnosis behind it. Because it is not random.
Yeah.
If I go to somebody with my stomach ache, if I get told you ate something wrong the evening before, or if I have to face the fact that there is a malign tumor that needs surgery for, and so on and so on. Disorders for symptoms make a huge difference, and they're crucial for any work in medicine.
Yeah.
And nobody would ever allow a physician to say, I don't care about your disorders. You gave me the symptom of itching skin. I don't care if it's a mosquito bite or a malignant melanoma, or I go with this bellyache that I just described, or with any other symptom to a physician, and I walk out without an answer, what's the disorder behind it?
Yeah.
One of the very few symptoms we allow this is tinnitus.
Yeah.
We go to see somebody, we come out without a diagnosis. It's just the description of the symptom.
Yeah.
And that is just not working. This is the actual problem. And to begin to talk about this question, you give me the symptom of tinnitus, and we both try to find out which disorder is behind it. That's the crucial moment. And this changes so much in the whole tinnitus experience for somebody suffering from tinnitus.
Yeah.
And it's not really so important how many subtypes there are, because the disorders sum up to, I don't even know the exact number, but it's more than 30 or 40. It's almost countless. It's so many disorders that can cause tinnitus. Most of them we know and we can treat. This is not so difficult. Even an earwax closes up my ear canal, gives me a hissing tinnitus. Yes, of course, but I know what to do, and when I've done it, it's done. It's gone. So,
Yeah.
is that a reason to discuss it? No, it's not, because I exactly know what to do. And frankly, the relevant disorders causing tinnitus, that's a very small number.
Mm.
It's important for physicians to know at least 5, and for somebody just being interested in the matter, it's almost sufficient to know about 3 disorders, because these 3 disorders cover more than 80% of the subjective tinnitus cases in a generalist's practice, in a family doctor's practice, and in ENT physician's practice. It's only 3 disorders, and it's not so difficult to
Yeah.
learn them and to know them. And that's why the important step is to ask what disorder lies behind the symptom. And this is
Yeah.
actually a self-evident matter or situation in medicine. We must not forget that and just act to jump to a quick conclusion into symptomatic treatments. That's
Yeah.
not okay.
Yeah. Agreed. Um, so when we were in Italy on the retreat, I think I had an idea, but you confirmed for me that my tinnitus was somatic. And I feel like a lot of it is somatic. For somebody that has somatic tinnitus, um, not just somatic, but any kind of tinnitus, what would you say is the first thing that they should do for themselves in terms of seeking relief?
As a matter of fact, you mentioned Italy and you mentioned the retreat. Just let me give one sentence to this.
Sure,
To
of
this,
course.
to be in a retreat over a whole week with 3 international experts in
Yeah,
this field is, of course, a very luxurious situation, which provides any information I want to hear about my situation, about tinnitus in general, and so on. So there is a very limited amount of slots for this kind of very, very specific kind of therapeutic opportunity. But
yeah,
that's not absolutely crucial to find a good way of treat an individual tinnitus situation. We can do it in many ways. And the important first step is to decide, I want to find the information for these 3 questions. First, what is happening? What are the disorders, or what is the disorder that is causing my tinnitus? How did I get into this? Secondly, what can I do about it? what are my options for help to alleviate my situation? And then what I like very much, as you know, to really find something like a healing is to find a meaning behind all that. As human beings, we want to see the meaning behind something. We're not satisfied with just a superficial kind of, answer about a medical condition and the options of treatment. We want to know more. We want to be calm. We want to find peace in this situation. And therefore, we need to answer the question, what am I doing with this in my life? What does that mean to me? What are the real answers for me? What decision I have to make in my life? But this is, of course, very ambitious in one way. When I seek medical treatment, the first two steps are the most important one. And what is happening with me, of course, is the question, what is the disorder? How do I find out? How can I diagnose what is happening with me? And most important, I'm not satisfied with simple answers the way we cannot do anything, leave my practice, you gotta get used to it. Yeah. I want to know what's happening. This is the most important step. And then I find answers. Nowadays, we live in a digitalized and globalized world. So no matter where the person is, I don't even need to speak their language. I can access this information. And the information is, how do I find out about my disorder, which is subtyping my tinnitus, or which means find out the disorder. And this is, of course, kind of a specific medical work, but it's not that difficult. Yeah. One of the very easy steps is just to ask me, where do I hear my tinnitus sound anyways? This gives so much information about the disorder already, which we totally forget. Physicians would usually not ask these important questions. Where is the tinnitus sound? How was the onset? What is the characteristic of the sound? How does it sound anyways? Does it stop for some while? Is it absolutely continuous? Is it a pulsating sound? These important questions are not asked, but they're very important. And they tell so much about the disorder.
Yeah. I didn't actually know when some of the people on the retreat kept saying that they hear the tinnitus in their head. And I had never heard that before because I hear mine in my ears. And I thought, what do you mean you hear it in your head? I just couldn't wrap my brain around it. So why is that important where you hear it?
Well, as I said before, because it points any specialist towards the preliminary diagnosis. When the disorder is happening in the ear or very close to the ear, then I will perceive the tinnitus more localized as in an ear. When I have a sudden hearing loss on one ear, well, the tinnitus will be only on one ear where I have the drop of my hearing function, and I will definitely say it's my ear, and the characteristic of the tinnitus sound will follow the type of hearing loss. If it's a high-pitched hearing loss, my tinnitus will be high-pitched. If it's a very broadband hearing loss, it will be more a hissing, or a very broadband kind of sound. It's as simple as that. And if my disorder is happening in my auditory brain, then I will tell, I cannot localize it really. It's more like a stereo sound. It's everywhere. It's in my head, or I don't know where it is. It's, happening. This points toward the auditory brain as a more centralized, brain-related tinnitus subtype. And for the person experienced in tinnitus treatment and diagnostics, it's so important to hear this description, because after 5 minutes, I basically know what's happening. I need the diagnostic to confirm what I
Mm.
actually already know.
Yeah.
And that makes things actually very simple.
Does it matter how long you've had it or the type of tinnitus that you have? Can all types of tinnitus be reversed? Are there types of tinnitus that can't be helped?
Yes, there are types of tinnitus that can't be helped. Yes, unfortunately, yes. Um, when the incident was very traumatic to the inner ear, so that even morphological changes happen in the inner ear from an explosion, for example, uh, then very often it is not possible to reduce the tinnitus perception to a degree where the person would say, I can barely hear it or so. Yes, that happens, but rarely. Most of the disorders that we know causing tinnitus um, are curable, are treatable, at least treatable, so
Yeah.
that the tinnitus perception goes down to a degree where I say, okay, well, I don't care much anymore. I can live my life, I can work, and it's okay, you know. And many disorders, at least the brain-related subtype, because of its nature, and also the inner ear-related subtype, even when somebody becomes deaf, can disappear to a 0-degree situation. Somebody is deaf, had a tinnitus, tells you today, well, I actually do not hear any tinnitus sound anymore. We can habituate even an inner ear related tinnitus coming from a deafness, from a deaf ear, where the deafferentiation, the drop down is 100% from an inner ear. Even these people can tell us, I do not hear any tinnitus sound anymore. And the
Yeah.
same with the somatic subtype, with a body-related subtype. Um, it's a little bit tricky in this subtype, we have to know. But so many people tell us, I did this and that, and I lost my tinnitus perception. And it's a very logical thing, because it happens from a body structure, interfering with the auditory processing in the brainstem, and they're producing this kind of sound, and which is then perceived as a tinnitus sound, and so on. But when the disorder is treated successfully, then the tinnitus ceases. That's it. So most of the common tinnitus causing disorders can be treated, and most of them can be cured. That's a fact. That's why I get so upset when I hear tinnitus experts say, there is no cure for tinnitus right now. I'm upset because of two reasons. First, to generally talk of tinnitus as a symptom is just prohibited for a tinnitus expert. Okay, we must not talk of the symptom as such. We have to talk of the disorders specifically. That's
Yeah.
our duty in my perception.
Yeah.
And then we can talk of the disorders. Some of them are extremely difficult to treat. Yes, many patients of this subtype are not curable because of what they exhibit inside of them. Yes, some subtypes of tinnitus are even not curable. That is true, but the majority is.
Yeah.
That's the truth. And that's what we need to communicate to
Yeah.
anybody perceiving tinnitus. And if we don't, we should not say a word about tinnitus anymore, because we frighten people very much when we as experts tell wrong information, when we share wrong information about a symptom that frightens people so much.
Yeah.
Our duty is to tell the truth. This is not easy to understand, yes, but it is important to communicate. It's always possible to diagnose your disorder, and it is always help, no matter in which direction it goes. If it's psychotherapies, if it's physical therapies, if it's hearing aids or other forms of audio stimulation, just to name the big three disorders, it's always possible to diagnose. It is always possible to help. And
Yeah.
that's the right type of information. And we need to give this type of information. That is really helpful. That is a positive way of dealing with it for tinnitus sufferers. And that's something they can work with. And that's where we want to be together. We
Yeah.
want to work together, and we do not want to exclude or to frighten or to isolate tinnitus sufferers from this path of diagnosing, of managing, of finding the meaning behind it. It's as simple as that.
Yeah. As an ENT doctor, I've been to a couple in the past couple of years, and I feel like where I live in Toronto, in Canada, when you talk about tinnitus, they automatically say, here's some hearing aids. This is going to make you better.
Yes.
That's not necessarily the case for everybody. Sometimes
Absolutely.
hearing aids can make you worse depending on where you are in your tinnitus journey, because amplifying sound may not be the best thing for you in that moment. So as a person walking into a clinic where they say, here's these hearing aids, if you wear them for a certain amount of time, it's going to help you reduce the perception of your tinnitus. How do I know if that's a good decision for me or not? How do I know whether or not hearing aids are something that I should even entertain?
What you described is a big problem,
It's a huge
because
problem.
it's a huge problem, because it is the same from the ENT physician side. That is the thing with the CBT, with the cognitive behavioral therapies for tinnitus in general. It's an unspecific attempt to use some therapeutic measures to unspecifically treat a symptom that I don't understand. And this is wrong from the side of ENT physicians. The answer is very simple. What kind of disorder do I treat with hearing aids or other forms of audio stimulation? Very simple. That are the ear problems, the inner ear related tinnitus subtypes or subtype, which exhibits a hearing loss, is requiring a audio stimulative type of therapy. So if there is a hearing loss, then I can use hearing aids or other forms of audio stimulation to improve a situation of the patient and mostly of the tinnitus perception. That's why we use hearing aids or
Yeah.
any form of hearing therapy, of attempts to bring a hearing back. There are other forms, cochlear implants, implanted hearing aids. The usual hearing aids, just the most simple form of it, but a very broadly used, and it's good to have it in use because so many people exhibit hearing loss. Of course they do. And I will use it in forms of inner ear related tinnitus. That's where they belong. And they are often used in forms of the brain related tinnitus subtype as well, because these people are often elder people that at the same time have an inner ear hearing loss. Those two are connected in some ways, and that's why we tend to use hearing aids in forms of brain-related tinnitus subtypes when there is the slightest form of hearing loss at the same time. Even
Mm.
if we know the primary problem is the brain-related subtype, if there is a hearing loss, we tend to give hearing aids because it will help to some point. The problem is when we say, this hearing aid will solve your problem. This is a lie. This is not true. It's good to say it will be of some help because it will reduce the portion of your tinnitus that comes from your inner ear hearing loss. Even if that's very small, it's good to have it.
Yeah.
And we know that hearing aids help to restore cognitive functions. And to do this always helps with the brain-related subtype. The more cognitive potential we can save over the day, the more helpful it will be with the brain-related subtype, because this is so stressed out. You know, this subtype is so much stressed out and in pain and in seek for help and in seek for, you know, a solution and so on. So hearing aids do help, but it's important from the therapeutic side to tell the truth. It is a little helper. It's not the answer to your problem.
Yeah. I think the problem that I was having personally is that, you know, you go in, you get a hearing test, they show you the hearing test. I don't know what I'm looking at. I don't know whether or not this hearing loss is maybe normal for my age. I have no idea. And you kind of feel like you're walking into like a sales pitch kind of situation, and they're just pushing these hearing aids onto you. So as somebody that is just looking at this chart, I don't really know what it means. And I think that's where it falls short a little bit, is that we really don't understand what we're looking at when we see this hearing test. So we don't know whether or not the hearing aids are really going to be helpful for us. So, you know.
That is true. And this does not necessarily need to be as long as I can trust. And the relationship between a patient and a therapist or a doctor is primarily a relationship of trust.
Yeah.
It's a necessary element. Otherwise, it doesn't work.
Yeah.
There are a couple of elements that we need to mention at this point. First of all, the body-related subtype of tinnitus, the one that is related to body structures, is not to be treated with audio-stimulative therapies. Not at all, because this subtype actually hates any kind of audio stimulation. I often have a specific form of hyperacusis for a certain frequency that is close to my tinnitus frequency. So I absolutely don't like that. So audio stimulative therapies, no matter if it's hearing aids or any other form, maybe an exception is the bimodal stimulation. It uses audio stimulation together with a somatosensory stimulus. There it might be of help. Also the notched type of therapy where I cut out the tinnitus frequency from a audio stimulative stimulus. But in general, hearing aids are never the solution for a body-related tinnitus subtype. That's number one. And the second one was, I forgot. What was it? I will tell you later. I'm sorry, I forgot.
It's okay. I wanted to ask you if you think that it is just as important to work on, like for somebody like me that has somatic tinnitus, I know there are certain things that I have to work on in terms of keeping my body de-stressed, keeping, you know, my neck and my shoulders and everything kind of calm and loose. Do you think that it is just as important to work on your psychological self, to work on things that may be unresolved emotional issues and that type of thing, just as well as the physical side of it?
Yeah, I really like this question. It's a very important question. First of all, uh, the subtyping of tinnitus disorders is very helpful to simplify the situation of a tinnitus sufferer. Therefore, it is very helpful. But at the same time, we need to know that the disorders causing tinnitus very often overlap even in one person. Even the big three, the hearing loss, the brain-related subtype, and the body-related one, are not rarely happening in one and the same person. So, as important as it is to differentiate the subtypes, as important is it to know that very often they occur together in one person. That's why treatments also need to be overlapping and be combined from the different subtypes, very often in practice. Second point is, we come from a cultural background that is very proud of having developed the analytical method and the scientific method, because it gave us so many advantages in our industrialized life of the last 150 years at least. We need to know that this whole development took place because we made a very important separation in our thinking of body and mind. We separated the thinking from the physical perception. And that's why also in medicine, we often either talk of physical things or of mental things. We have lost the understanding of the fact that both are always together in a human being. So things like body-mind medicine or holistic thinking is something that actually doesn't happen in medicine right now. When we go to have surgery on our bodies, we're not talking of what is happening in our minds. We go there, have the surgery, we heal our wound, the threads are pulled, goodbye. So we tend to see either this or that side of a human existence. We're not used to put them together and ask, when there's happening something on this side, what's actually the consequence on the other side? And that's why it is also important to ask, what is actually happening in our mind when we develop this subtype of tinnitus? What's the counterpart? What's the mirror picture of a body-related tinnitus subtype? Or what is happening in a mind of a human being developing a brain-related tinnitus subtype? These questions are not asked right now.
Yeah.
But there are interesting answers to that. And for the body-related subtype, it's in very generally speaking, it is some form of density that has come to me in emotional things where I feel kind of dense and in a cage, and I lost my feeling of being free and let go of my emotions and be creative, be free. That is in some ways what happens inside a human being developing a body-related subtype of tinnitus. So this is also something somebody experienced will address the moment she or he treats somebody with some body-related tinnitus subtype. And it is important for a person dealing with this subtype because it helps to improve the
Yeah.
outcome of the treatment. So that's why I love the question so much, because it points our interest towards what is happening inside a human being develop this type of subtype in tinnitus.
Yeah, I think often people are looking outward for their answer. What can I
Exactly.
do? What treatment can I go to? But we forget that we also have to turn inward and sort out what is not working, either in our thoughts, in our emotional being, in our psychological state. I think both of those things have to be done hand in hand.
Absolutely. Remember the words of Julian Cohen-Hill in the retreat, saying that perceiving a tinnitus is, first of all, that we put our attention from listening to us to a state where we start to primarily listen to the outside because we want to scan for danger.
Yeah.
This is the very fundamental thing happening in very, very many tinnitus patients, if not the majority.
Yeah.
So that's exactly what you just said. You know, starting to sense inside again more than to scan outside for danger is one of the very fundamental things to address in any tinnitus treatment. And this goes very deep,
Yeah.
very, very deep. And
Yeah.
it, first of all, uh, is something that requires my uh, fulfillment of my need for safety and for security. You
Yeah.
know, I will never stop scanning outside as long as I feel insecure and frightened and anxious.
Yeah.
That's why it's so important to have this kind of conversation between a patient and a doctor, because we want to create the feeling of trust and safety. Otherwise, a tinnitus treatment will never have the chance to be successful.
Yeah.
And, you know, these are the circumstances that go all hand in hand in a successful tinnitus treatment.
Yeah, tinnitus, from what I remember Julian saying, tinnitus kind of makes you go up and out. It's like an alarm
Exactly.
constantly, and you're constantly like afraid of this thing. But what is going to help you calm it down is, instead of up and out, for it to be down and in. So turning inward into yourself and calming yourself is in turn going to help your tinnitus, or the perception of your tinnitus, be reduced. That was really important.
Yes, to become very philosophical now. The
Mhm.
brain-related subtypes makes you going up. The body-related subtype makes you going out. And
Mhm.
the inner ear-related subtype makes you going down. And
Interesting.
and and so on and so on. So this is, of course, very far, but these are uh, the lovely and interesting questions about tinnitus treatments. Um, you cannot do tinnitus treatment nowadays without becoming very individual, becoming very authentic, and becoming very differentiated.
Yeah.
And that is something that lacks modern medicine in many ways in everyday practice. And that's why these approaches in tinnitus treatment, I think, have something to give to modern medicine as well.
Yeah.
That's why I like it so much.
Michael. I just honestly, like, it means so much to me that you took the time to do this with me. I feel like oftentimes as tinnitus patients, we feel discarded, we feel unheard, we feel like nobody takes us seriously. And I just think this is so lovely of you and so kind of you to give up your time, to be with me, to help as many people as we can, to reach as many people as we can, to share the understanding that this is not a death sentence, that we can get better, that we do not have to live with it forever, and that there is help. And especially coming from you, coming from an ENT doctor, that means a lot to a lot of us. It's quite opposite of everything that we've heard. So I just want to say thank you so much for taking the time. Thank you for doing this with me. And I appreciate you so much.
You're most welcome, Tamara. It's my pleasure, and it's also my deep conviction. It's my work that I put so much heart and effort and everything in it, and I do this because also because it's just my way of dealing with it, and I deeply think and am convicted in the fact that there's one side of dealing with tinnitus very superficially, and there's another growing community that tries to provide a deeper help and health.
Yeah.
And anybody being on my side is welcome and has access to whatever I know and whatever I do at any time. And that's why I really love to be here today. And thank
Thank
you
you.
for inviting me.
Thank you so
Thank you
much,
very much.
Michael.